Hi, my name is Juliana Cook and I'm a family nurse practitioner student at Auburn University. Today I'm going to be completing a head-to-toe assessment on my patient for my class 7116 Advanced Nursing Assessment. Before coming into the room, we took a set of vitals on the patient. We took a heart rate, which was 73, a blood pressure, which was 103/64, respirations, which were 13, and we got a height and a weight to calculate a BMI of 24.5. All of that was within normal limits for this patient. We also did a visual acuity test using the Snelling chart. The patient had 20/20 vision in her right eye and 20/20 vision in her left eye. We also, for video purposes, are not going to take off the patient's shirt to assess her skin and to auscultate. So just for video purposes, it's going to stay on. In a real life setting, I would be auscultating under the shirt, and I would also have the patient take their shirt off so I can assess the skin fully. So today, what I'm going to do is I'm going to start off looking at your face. I'm going to start looking at your skin. I'm going to look at all of the symmetry. I'm going to look at your head. I'm going to palpate your head, see if there's any nodules, any tenderness. Perfect. I'm going to look at your hair. It's well distributed throughout and very healthy. Perfect. So now what I'm going to do is I'm going to palpate your sinuses, okay? I'm going to palpate your frontal sinus. Any pain, tenderness?
No.
I'm going to palpate your maxillary sinus. Any pain, tenderness?
No.
Perfect. Now I'm going to palpate your temporal mandibular joint. So I want you to open up your jaw, close it. Now open it up and move it side to side. Perfect. Good job. I assessed that muscle right here for symmetry, swelling, and I didn't feel any. Good job. Now what I'm going to do is I'm going to look at your eyes, ears, nose, throat, and mouth. Okay? So what I'm going to do is I'm going to start off looking at your eyes. I'm going to look at your eyebrows. Your hair is well distributed throughout. They're symmetrical. I'm going to look at your eyelids, your sclera, your iris. All of that is pink, moist. I don't see any swelling, any edema, no redness. All that looks great. So now I'm going to look at your eyes using my pen light. Okay? I'm going to do the cover test. So I want you to cover this eye for me. Perfect. Now cover this eye for me. Awesome. That looked great. So now what I'm going to do is I'm going to check your pupillary reaction, okay? So just look straight at me. I'm going to shine a bright light in your eyes. Good job. Awesome. Her pupils were equal, round, and reactive. They were about 3 in size and brisk moving. Okay, so now what I'm going to do is I'm going to look at your nose, okay? So I want you to tilt your head up for me. I'm going to look for the patency of your nostrils. I'm going to look at your septum. It is midline. Both nostrils are patent, and your mucosa is pink and moist. Are you having any trouble smelling out of anything?
No.
Perfect. Okay, now I'm going to look at your mouth, okay? Your lips, they're pink, dry, and they are symmetrical. I don't notice any swelling, no edema, nothing like that. So I want you to open up your mouth for me. I'm going to look at the roof of your mouth. It's intact. All of your teeth are intact. I don't see any chips, caries, no missing teeth. I want you to stick out your tongue for me. Perfect. Move it up and down. Awesome. I'm going to look under your tongue now. Perfect. Now stick your tongue out and say ah.
Ah.
Awesome. I looked at her tonsils back there and I would grade them a 2. Okay, now I'm going to look at your ears. Okay, so I'm going to palpate your auricles. They're symmetrical on both sides. I don't feel any nodules, no tenderness, no swelling. Are you having any hearing loss, any ringing in your ears? Awesome. Okay, I'm going to look in your ears. I can see the ear canal. I can see her tympanic membrane. It's pearly gray. And I can see her malleus, incus, and scabies. Oh, that looks good. I'm going to look at this one too. Already palpated this auricle. Awesome. I can see once again her tympanic membrane, her ear canal is intact, no trauma. I can see her malleus, incus, and scabies. All that looks great. Good job. Okay. So now what I'm going to do is I'm going to test your cranial nerves, okay? All right. So I want you to close your eyes for me. Okay. I want you to tell me what you can smell.
Alcohol?
Good job.
Swab.
Perfect. Yep, that was great. That was good. So that was cranial nerve 1. Okay, so for cranial nerve 2, I'm going to have you close your eye, or close one eye.
Okay.
And cover it.
Okay.
Yep. Now I'm going to check your periphery, okay?
Okay.
So tell me when you see my hand.
Here. There. There. There.
Good job. Okay, now cover the other eye.
Okay.
Tell me when you can see my hand.
There. There.
Good job.
There. There.
Good job. Okay, so that tested our periphery. So for cranial nerves 2 and 3, what I'm going to do is I'm going to have you, I'm going to look at your eyes, okay? So I'm going to put this here and I'm going to do a light reaction test. So what I'm going to do is look at both eyes and I'm going to look for the pupils to react on both sides. And they do. Perfect. Okay, now I'm going to check for accommodation, which is also 2 and 3. So I want you to look at the pin light, look at the wall, look at the pin light, look at the wall. Good job. So for 3, 4, and 6, I'm going to do the H test, which is going to check for extraocular eye movement. So I want you to follow my hand, okay? Good job. That was 3, 4, and 6. Okay, so for cranial nerve 5, there's a couple tests I'm going to do on you. So what I want you to do is I want you to clench your teeth really tight. Clench on, clench on.
Okay.
Yeah, there you go. I'm going to feel that temporal and masseter muscle. It feels symmetrical on both sides. Once again, no swelling. Any tenderness or pain?
No.
Perfect. Okay, so now I'm also going to have you close your eyes. I want you to tell me if you feel soft or hard. Okay?
Soft. 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 Soft.
Perfect. Keep them closed. Tell me what you can feel.
Hard. 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 Hard.
Perfect. Okay, so that was cranial nerve 5. Okay, so for cranial nerve 7, I'm going to have you do a couple things. Okay, I want you to smile at me, frown at me. I want you to show me all your teeth and puff out your cheeks. Good job. And raise your eyebrows. Oh, perfect. All of those are intact. So that's cranial nerve 7. For cranial nerve 8, I'm going to complete an auditory test. So I want you to tell me what you hear. Okay?
War.
Eagle. Perfect. War eagle. I like it. So for cranial nerves 9 and 10, okay, I'm going to check your uvula and check your gag reflex, okay? So open your mouth big and wide, stick out your tongue, say ah. Okay, now I'm going to check your gag reflex, okay? Good job. That's definitely intact. Okay, for cranial nerve 11, I'm going to have you push up on my hands really quick, okay? Good job. Push, there you go. Perfect. That tested your trapezius and your sternocleidomastoid muscle. All right. Now I'm going to once again check for cranial nerve 12. This is going to be the movement of your tongue, okay? So I want you to stick out your tongue, move it up and down. Good job. Move it side to side. Perfect. Push against this. There you go. Push against this. Awesome. So cranial nerve 12 is also intact. So now for cranial nerves 5, 7, 10, and 12, I've listened to your voice, I've heard you articulate, and that is all completely intact. So that looks great. So now I'm going to go back and I'm going to look at your eyes really quick. Okay? So I'm going to check your macula, your fundus, your disc, your blood vessels, and your red reflex. Okay? Okay. So left eye. I'm going to look at your left eye. Okay? Good job. I can see her disc, her macula, her red reflex was intact, and I can also see all of her blood vessels, okay? So now I'm going to check this eye. Good job. All that was intact as well. Okay, so now we've done your cranial nerves. Now that we've done your eyes, we've done your ears. Now what we're going to do is we're going to check your throat, okay? All right, so now I'm just going to look and palpate. Her skin is intact. I don't see any nodules, no swelling, any tenderness.
No.
Perfect. Okay. I'm going to feel for her trachea. Her trachea is midline. Okay. I'm going to feel for your thyroid. Okay. So I'm going to have you swallow a few times. Okay. So I want you to swallow. Good job. I want you to turn your head to the left and swallow. Perfect. Now turn your head to the right and swallow. I know it's hard to swallow on command. Good job. That was perfect. Okay. So now what I'm going to do is I'm going to palpate for your carotid pulse. Okay. It's 2+. Its rate and rhythm are correct. They're normal. I'm going to feel this side. Rate and rhythm are great. 2+ as well. So now I'm going to auscultate for any bruise, okay? Perfect. Perfect. I do not hear any bruise palpable, okay? Or auditory. Can't talk today. Okay, so now what I'm going to do is I'm going to check your lymph nodes, okay? You have a bunch on your neck and your head, okay?
Okay.
So I'm going to start from the back. I'm going to palpate your occipital, your posterior auricle, or your anterior auricle, your parotid, your retropharyngeal, submandibular, your macular, your anterior cervical, posterior cervical, and your supraclavicular. Good job. All this, I don't feel any nodules. They're moving. You're able to move them. They're not fixed. Okay, and none of them are enlarged, which is a good sign. Okay, so now what I'm going to have you do is I'm going to have you step off the table. Okay, I'm going to have you turn around.
Okay.
Okay, so now what I'm going to do is I'm going to inspect your posterior chest. Okay, I'm going to look for symmetry. I look at your skin. I don't see any scarring. I don't see any redness, no tenderness in here. Perfect. It's all symmetrical. So now what I'm going to have you do is I'm going to have you breathe in.
Okay.
Perfect. Now breathe out. Awesome. That tested your chest excursion and it was equal on both sides. Okay. So now what I'm going to do is I'm going to do your tactile fremitus. So I want you to say 99 when you feel my hand on your back, okay?
Okay. 99, 99, 99, 99, 99, 99.
Perfect. Okay, all of that was normal. Good feel. All right, so now what I'm going to do is I'm going to percuss your chest, okay? In a couple different places, okay?
Okay.
Okay, so now what I'm going to do is I'm going to feel for your diaphragm, okay? It's called diaphragmatic excursion, okay? So I want you to breathe normally, and then what I'll tell you to do is I'll tell you to take a deep breath in, and then take a deep breath out, okay?
Okay.
You'll hold in between of those, okay?
Okay.
Okay, I want you to take a deep breath in, hold it. Okay, now let it out. Okay, so I'm going to measure this. All right, it's about 4 centimeters, which is completely normal, so good job, that's great. Okay, so now what I'm going to do is I'm going to check for CDA tenderness, so I'm going to beat on your back a little bit. Tell me if this hurts, okay?
Okay.
Any hurt?
No.
Any hurt?
No.
Perfect. Okay. So now what I'm going to do is I'm going to auscultate, okay? I'm going to listen to you. Once again, I would have her shirt off in real practice, but for today I'm going to leave the shirt on. Okay, so as I was listening to her, I was also watching her respiratory rate. Respiratory rate was completely normal. We had equal chest excursion. I heard breath sounds throughout all the bases and all the apices, and now they were clear throughout. Okay, so I want you to sit up on the table, and we're going to do it on the front, okay? Okay, so now I'm going to look, once again, inspect the chest, look at the skin, look for symmetry, look for any swelling, any tenderness, anything like that. Okay, I'm going to palpate for your apical, or palpate right here. Okay. Okay, I'm going to palpate her apical impulse down here. I don't feel any pulsations or thrills throughout, so all of that looks great. Okay, so now what I'm going to do is I'm going to percuss again, okay? I'm going to beat on your chest some more. Okay, all right, all that was normal. So now what I'm going to do is I'm going to listen to your breath sounds throughout, okay? Okay, I watched once again her respiratory rate and rhythm. All of that was normal. I listened to breath sounds throughout and they were clear. Okay, so now what I'm going to do is while you're setting up, I'm also going to listen to your heart. Okay, I'm going to listen to all the pieces. I'm going to listen to it twice. Okay, the diaphragm and the bell of my stethoscope. Okay. So I'm going to go aortic, pulmonic, second pulmonic, tricuspid, and mitral. Okay, I'm going to listen to it one more time with the bell. Aortic, pulmonic, second pulmonic, tricuspid, and mitral. Okay, perfect. All that was normal. I had normal heart tones. Everything was great. Your rate and rhythm was also perfect. Okay? All right. So now what I'm going to do is I'm going to have you lay down. Okay?
Okay.
Pop this up for you so you're comfortable. Okay?
Okay.
All right. So I'm going to listen to your heart tones one more time laying down. Okay?
All right.
Aortic, pulmonic, second pulmonic, tricuspid, and mitral. Good job. Okay, those were good as well. Okay, so now I'm going to check your pulses really quick, and check your radial, your brachial. So I'm going to check your radial, and your brachial. Good job. Okay, all of those were 2+ all over. She's pink, she's warm, they had a regular rate and rhythm. Okay, so now what I'm going to do is I'm going to assess her abdomen. Okay, I'm going to pull your shirt up just a little bit, okay?
Okay.
But first I'm just going to look. I'm going to look for any scarring. I'm going to look at the contour. I'm going to look for any swelling, any distension. I don't see any. Her belly is soft and flat right now. I also don't notice any pulsations, so that's good too. Okay, so now what I'm going to do is I'm going to listen to your abdomen, okay? I'm going to listen to your stomach. I'm going to listen to all 4 quadrants, and then I'm going to go and listen to your iliac, femoral, and your renal. I'm going to listen for bruits in them. I can't get that word right today. Yeah, definitely. You're hungry.
Mm-hmm.
Okay, and I'm going to listen for aortic, iliac, your renal, didn't hear any bruise. Your bowel sounds were very active. They were very active. And they were heard in all 4 quadrants, okay? All right, so now what I'm going to do is I'm gonna percuss your abdomen, okay?
Okay.
So I'm gonna beat on it a little bit more. Okay, well, that looked good. So now what I'm gonna do is I'm gonna percuss for your liver span, okay? So just kind of breathe normally for right now. You heard that? Okay. All right, so now what I'm gonna have you do is I'm gonna have you take a deep breath in, hold it. Okay, let it out. Okay, let's measure that. It's about 7.5 centimeters, which is completely normal once again. Good job. Okay, so now what I'm going to do is I'm going to palpate. Okay, I'm going to lightly palpate your abdomen first. Any pain, tenderness? Good job. Pain, tenderness over here?
No.
Okay, I'm going to deeply palpate. Any pain, tenderness here? Okay, perfect. Now what I'm going to do is I'm going to palpate for your liver, okay? Okay, so what I'm going to have you do is I'm going to have you take a deep breath in and then let it out. Perfect, you can feel it. Okay, now I'm going to go over to your spleen and try and feel the tip of your spleen because that's about all you can feel. Okay, so take a deep breath in, let it out. Perfect. Now we can palpate for your aortic, your abdominal aorta, and I can't feel that most of the time. And then you're going to feel for your kidneys, which most of the time you can't feel them either. Okay, good job. Now the last thing I'm going to do is test your abdominal reflex, okay? Yeah.
Soft?
I know, it's definitely intact.
Wow.
Yep. Okay, so now I'm going to have you sit up, okay?
Okay.
I'm going to go back to your neck really quick, and I'm going to have you do some range of motion in your neck, okay? So I want you to flex down, flexion, go back, extension, rotate to the left and to the right. Perfect. That's rotation, and then I'm going to have lateral bending, so this way. Good job. This way. Good job. Okay, so that was intact. Now I'm going to look at your arms, okay? I'm going to inspect your arms, your shoulders, all that looks good, okay? And I feel for any swelling, any unevenness, any pain, tenderness. Go all the way down your arm. Your muscle mass is equal on both sides. I don't feel any epitropial nodes on your elbows. I'm going to look at your wrists and your hands. All of those are normal. Your fingernails are intact. I don't notice any clubbing. Cap refill is definitely a 2. Looks great there. Okay. Awesome. So I'm going to have you close your eyes and I'm going to test, okay? Something again.
Okay.
I want you to tell me if it's soft, hard, or vibration. Okay. All right.
Soft, 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 soft.
Perfect.
Hard, 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 hard.
Perfect. Now one more.
Vibration?
Mm-hmm.
Vibration. I can feel that. Vibration. 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 Vibration.
Perfect. Okay. And then what I'm also going to have you do, okay, is I'm going to have you test for coordination. So I'm going to have you touch your nose really quickly with both fingers. Perfect. And I'm going to have you put your hands on here and flip them back and forth really quickly. Awesome. Okay. Then I'm going to have you do some shoulder exercises, okay?
Okay.
So I want you First, I want you to lift your hands all the way up. Perfect. Now go all the way back. Perfect. I want you to go like this and go out and up, if you can. I know there's a wall. Yeah. Good job. Now come back down.
Out. Keep them out.
Keep them out. Okay. And then if you can, do as far as you can this way with your hand.
With the arms.
Yep.
Perfect. Palms back.
Palms back. Yep. Awesome. Okay.
Okay.
All right. Now I'm gonna have you scratch your back with both hands. There you go. Awesome. Okay. That was good. Okay. Now I'm gonna check your elbows. So I want you to go flexion, extension, go forward, and then backwards. Okay. And now I want you to go side to side.
Like
Perfect. Yeah, try not to bend your arm.
Oh,
Side to side.
okay.
Perfect. All of that looks great. Okay. So now your wrists. I'm gonna look at your wrists. Okay. So we're gonna do the same thing with your wrists. I want you to go up and down. Perfect. I want you to ball up your fist, up and down, and go side to side, and hands out, side to side. Okay. And then I'm gonna spread your fingers out. Good job. Perfect. Okay. Awesome. So now we've checked your range of motion in your shoulders, your elbows, and your arms. We've checked it in your wrists and your hands. Okay. So now what I'm going to do, I'm going to circle back around to your head. Okay. So I'm going to test lateralization of your head. Okay.
Okay.
So I want you to tell me if you can hear it on both sides of your head.
Okay.
Okay. Both ears.
Yep, I can hear it. Both sides.
Okay. Tell me when you can't hear it anymore.
I can't hear it anymore.
Okay. Perfect. All right, so now what I'm going to do is I'm going to check it on both your ears. It's going to check bone and ear connection. Okay, so I'm going to put this on your mastoid process. Tell me when you can't hear it anymore.
Okay. Okay.
Perfect. Okay, that was double the time. That was awesome. So now I'm going to check it on your other ear, okay?
Okay. Okay.
Okay, awesome. Okay, so now that we've done that, I'm going to check your reflexes, okay?
Okay.
So I'm going to check your triceps, so just hang your arm this way, okay? There you go. We got that one, okay? So I'm going to have you relax your arm on me. Just relax it. There you go. That was your bicep. Okay? And then we're going to check your brachioradial, okay? Good job. I felt that one. Okay, we're going to do the same thing on this arm. Good job. Okay, just relax. Good job. Okay, and then we're going to do it on this brachioradial again. Good job. That was awesome. Okay, good job. Okay, so now what I'm going to do is I'm going to inspect your legs, your ankles, your feet, okay? So what I'm going to have you do is I'm going to have you just sit here. I'm going to look at your muscle mass on both legs, your skin. I'm going to look at your knees. I don't feel any swelling, any tenderness.
Nope.
No. Muscle mass is even throughout. Your venous pattern is also even throughout, okay? All that looks great. I'm going to take off your shoes and your socks really quick, okay?
Okay.
Okay. I'm going to check out your feet. Your feet are equal. I don't see any swelling, any pain, any tenderness. No. Awesome. Okay, I'm going to check your cap refill while I'm down here. Cap refill's 2+. Okay. So now I'm going to have you lay back really quick.
Okay.
Okay. Have you relax. Okay. All right, so I'm going to feel for your pulses. I'm going to feel for your femoral. Perfect. I feel for your popliteal. Your posterior tibial. and your dorsalis pedis. Great job. Okay. So now what I'm going to have you do is I'm going to have you push up against my hand with this leg, okay?
Okay.
So push up as far as you can. Good job. Great. I want you to push up on this leg once again. Perfect. Good job. Okay. I'm going to have you close your eyes. I'm going to have you tell me what you feel again, okay?
Okay. Soft, 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 soft.
Perfect. Now tell me what you feel again, okay?
Hard, 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 hard.
Perfect. Now tell me once again what you feel.
Vibration.
Yep.
Vibration.
Perfect.
Vibration. 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 Vibration.
Perfect. Oh, that's great. Okay. So I want you to, while we're down here, you can open up your eyes again. Okay, I want you to flex your ankles. Okay, so put them up, then point your toes, then go out, eversion, and then inversion. Perfect. Okay, I want you to sprawl out your toes if you can. Perfect. Okay, awesome. Then I'm going to have you sit back up. Okay, scooch down a little bit further. I'm going to test your reflexes, okay?
Okay. Is that okay right there?
Yep, that's
Okay.
perfect. Okay, I'm going to test your patellar. Okay?
Ooh.
That was a good one. Ooh, that was a good one too. Okay, now I'm going to test your Achilles, okay?
Okay.
Ooh, that was good too.
Oh, yeah.
Good job. All of that was intact. She wasn't hyper-reflexive. It was normal. Okay. All right, so now what I'm going to have you do is I'm going to have you get down, okay? Put your shoes back on.
Okay.
Okay. We're going to test the range of motion in your legs, okay? So I want you, in legs and knees, we're going to do both, okay? So I want you to point your foot forward, your right foot forward, then go back, then go out front side. Perfect. Now go out back to the side. Perfect. Okay, now do the same thing with your left. So front, back, extension. Okay, then go adduction and abduction. Go out to the side. Perfect. Now come down. Go out to the side of the right leg. Perfect. Okay, so I want you to bend your knees. So bend.
Oh,
Well, that's fine. That worked too. Okay, so bend one knee.
Okay.
Bend the other. Okay, then extend it out. Perfect. Extend it out. Awesome. Okay, so that checked your range of motion of your hips and your knees. Okay? Alright, so now what I'm going to do is I'm going to have you come around and I'm going to check out your back. Okay?
Okay.
Okay, I'm going to look at your, we'll come this way so you can bend down.
Okay. So
I'm
wait.
going to check out your spine, okay?
Okay.
Alright, so I can feel it all the way down. Any pain, tenderness?
No.
I don't feel any swelling. Okay, so bend down, touch your toes. Nose, toes. All the same. Whoop, stay down there.
Oh, stay down?
Yep.
Okay.
Okay, I'm going to check for scoliosis. Perfect. You can stand back up. I don't see any scoliosis, any lordosis, any kyphosis. None of that. Okay? So now what I'm going to have you do is lean back towards me. Perfect. That's extension. Then I want you to stand back up.
Okay.
I want you to rotate left and right.
Like this?
Yep. Okay. Perfect. Then I'm going to have you bend side to side. Perfect. Oh, that looks good. Okay. Now turn around and face me.
Okay.
Okay, I want you to put your feet together. Okay, hands out. Okay, and I want you to stand there for just a second. I'm going to look for any swaying. This is the Robert test. Okay. Now close your eyes. Look for any swaying again. Perfect. That looks good.
Okay.
All right. So now what I'm going to have you do is I'm going to have you walk towards that wall just normally.
Okay.
Okay? Perfect. You've got an equal gait. You're not unbalanced. Oh, that looks great. So now I'm going to have you walk on your tippy toes towards me. Perfect. Oh, that looks good. Okay, and then I want you to walk heel to toe back that way.
Heel to toe.
Yep.
Like that?
Yep. Perfect. Oh, that looks great. Okay, so come back over here.
Okay.
Come hop up on the table one more time.
Okay.
Okay, I'm gonna test your muscle strength.
Okay.
So squeeze my hand. Perfect. Oh, that looks good. I want you to push up against my arms. Perfect. And then push up with this knee. Perfect. Push up with this knee. Perfect. Okay. All right. I believe that's everything.
All
Thanks.
right.
Yeah.